I'm Lucy Brown. I am the Director of Nursing Midwifery Leadership Development at the Florence Nightingale Foundation. And I have the absolute pleasure of hosting our webinar series. And today we're really excited to welcome a host of experts from the clinical informatics world, where we're going to have a short presentation and then have a bit of a Q&A, bit of a panel discussion, and then we'll open up to questions from all of you on the floor as well. So we're really excited to be sharing their expertise with you, really giving an introduction to that world of clinical informatics. Before we get started, I'm just going to do a bit of housekeeping. So we'll be recording today, so I hope that's all okay with you. Also, just be mindful of what you say, and if you obviously if you want to turn your cameras off, that's okay. If you have any questions, please pop them in the chat and we can ask them at the end, or feel free to raise your hand at the end of the presentations and panel session if you want to ask any questions. Because we are recording, what's great is we'll host this on our YouTube channel, so please do share with colleagues who you think may benefit from the webinar. It'd be really great. And again, we would love to hear of any topics you would like us to cover within the webinar, so please do keep in touch. So thank you. I think that's all the housekeeping done today. So I'm going to hand across and just give some introductions to our wonderful panel. So first and foremost, we've got Sam Neville joining us. She's a Chief Clinical Nursing Informatics Officer at Mid and South Essex Acute Trust. So brings a wealth of experience and been heavily involved in the Midwives inquiry, which I'm sure she'll tell us more about shortly. We've also got Claire Sutton, who very exciting has been promoted. I'm sure she'll tell us a bit more about that at the moment. She's just left a role as Digital Transformation Lead at the National Care Forum, and we're moving into a transformational lead role at the RCN. I'm sure you'll give us a bit more detail in a bit, Claire, so many congratulations on your new post. And Claire's also on the PRSB board with me, the Professional Record Standards Body, which obviously looks at standardising our approach to records. So it's great to have you, Claire, a fellow advisory board member. We will also welcome Simon Knoll, who's again a Chief Informatics Officer, Nursing Officer at Oxford University Hospitals, who brings a wealth of experience to share with us this afternoon. And last but not least, we have Jan, who's joining us from the Faculty of Clinical Informatics, their business manager, who'll be sharing the expertise from the Clinical Informatics faculty as well. So thank you all so much for joining us this afternoon, on a Friday afternoon as well. We're really, and a sunny one at that too, if that is where you are in the UK anyway. So Simon's got a short presentation for us. So I'm sure Simon's going to share his screen and just talk through a bit of an introduction, and then we're going to go to the panel session. I'm going to quiz all of the guys for you to ask some questions about their careers and give some insights and encourage you to join the Clinical Nursing Informatics Network. So over to you, Simon, when you're ready.
Okay, so I'll just share my presentation. Can you see that okay, Lucy?
That's great.
Okay.
Thanks, Simon. Absolutely perfect.
So I've been asked just to do a brief introduction to the work of the Faculty of Clinical Informatics. Just to give a bit more background, I'm a member, but I'm also on the Nursing Midwifery Professional Interest Group, and also the Professionalism Standing Committee, and also a couple of other working groups within the faculty. So more of that just in a moment. So the faculty is here to try and provide an all-round view and an all-round support for clinicians going into the world of clinical informatics. The idea is to present a vision of what safe and effective clinical informatics should be, and help our clinical colleagues to be able to support and enhance and progress what they're doing in their own workspaces. The values as well are really important because they show how we can encourage organizations and trusts to accept ideas to do with clinical informatics and informatics workflows, and enhance the work of and the working of clinicians in that area, and provide action on helping groups to giving professional guidance and opinion on the way clinical informatics should work. And one of the things we've been working on recently is the office, the CCIO working group, looking at the way that that role evolves and progresses, and how that's supported within different organizations. So there are multiple ways in which we try and support clinical informatics, and you can see many of them here. I think from my perspective, some of the most important ones are the mentoring, the webinars, and the CPT accreditation, because what they do is they allow an avenue of support for people coming into clinical informatics, and even those people who have been in the field for quite some time. They allow a resource for such as this one, for example, for those people who want to learn more, and also supporting educational organisations in providing meaningful and structured education to those people coming into the field, so that we can progress the profession and that we can provide cohesive and robust support for what the profession looks like. And we all know that the clinical informatics is expanding exponentially in this country at the moment, and the work I feel the work we're doing is actually quite fundamental in helping to support that process. You can see here also, we're also talking about the professionalism, the job description work, and as I say, I'm on the special interest groups for the CCI job description and for the nursing midwifery professional interest group. They tend to call it NAMPIG, and it's not really a very good acronym, but let's not dwell on that too much. If we look at the core competency framework, you see here there are 6 domains, and they're very much self-explanatory. But the idea is to provide a structure and a cohesive support for the way that clinical informatics is being supported. It provides a structure to members and to people who want to access the work of the FCI, so that we can provide a comprehensive range of skills, advice, training and direction, so that they can progress their careers, understand where they go from here, and then also provide structure for their colleagues and peers as to how they can be supported through their informatics career. And you can see it's really comprehensive, so not just 6 domains, but 36 categories and 111 individual competencies. So there's quite a lot there, but it's really good to dip into and get some insight and understanding about what clinical informatics is, what it should look like, and how we can support others in progressing it. So we have accredited courses and qualifications, for example. We enable employers to develop a job description. So in the professional interest groups, and also just in the faculty itself, providing help and support and guidance between different faculty and members about how they have approached developing digital in their organizations, enhancing the work of the workforce, but also providing the baseline and structure to enable safe and effective deployment of informatics in their area. So there's lots going on in this, and also it's good to remember that it's not just the acute sector. I mean, we are keen to support primary care and non-NHS environments as well. So this is where we can provide comprehensive and wide-ranging support, because if we provide wide-ranging support, it means that the level of care and education and integration that we have across, particularly things like ICS, as they develop in the future, can be more robust. So how can you get involved? What can you do? You can become an associate, a member, or a fellow. There are applications all year round. As it says here, we have rounds for members, fellows twice a year. So if you want to become a member or a fellow, then you certainly can do so. But just as an associate, you can still access a multitude of information and a multitude of resources to help support you in your working life. And as I've mentioned before about the committees and the working groups, that there are multiple opportunities to help support and to provide your insight into how digital and health informatics can progress. So it's not just a static thing. You can take, but it can also give. And I think that's the important thing, that we can share our experiences. And the more experience we have to share, the more that we can have a more well-rounded view of what informatics is in this country, and indeed for colleagues around the world. It's a really good opportunity to share our experiences. So contact details are here. It's very straightforward. You can just Google it and look for the Faculty of Clinical Informatics. The page is very easy to navigate, and you can find all the information you need there. But also, I believe we'll be sharing some of our contact details at the end of the meeting. So if you do want to get in touch, and both between, say, myself or to Jan, then please do so, because we're more than happy to have a chat and discuss and provide support that the colleagues need. So yeah, so that's our brief introduction to the Faculty of Clinical Informatics. I hope that was clear enough for you, Lucy. Is that okay?
That's absolutely perfect. Thanks, Simon. Thank you so much. And obviously we're going to delve a bit deeper into your role so we can understand a bit more about the clinical informatics world as well. Just one question quickly from me out of my interest, and I hope this will be appropriate for everyone. But what's the difference between an associate, a member, and a fellow? If you're joining that, I think that might be a question for Jan.
Jan, there you go.
So an associate is somebody who's got an interest in clinical informatics and wants to find out more, may or may not be working in that area. A member and a fellow are somebody who've been working in clinical informatics for, sort of a certain length of time and have built up expertise and experience in that area.
So then they can share their expertise with those with an interest.
Exactly.
Yeah, it's a good opportunity it's a nice way of having a designation between those aspirant digital people and the experienced digital people, and obviously there's level of experience or a level of seniority within different organizations, and the membership, or say the fellows, for example, are really established, very well known and very well respected members of the informatics community. But members like myself, I mean, I've got 22 years experience working in clinical informatics in one way, shape or form. So whilst I have a wealth of experience to share, and that's the way we try and show or who does what and where. But the associate members are brilliant because they can access the resources and start to develop.
Brilliant, that's great. Sounds a fantastic opportunity, and perhaps urge everyone on this call to perhaps consider joining the faculty, because it's a very interesting society. So we're going to go across to the panel session now. So I hope you're all ready, panel, for some questions and grilling. Not really, just some questions. So just really, I think I'll probably come to you first, Claire, if that's okay, because you're just about to start a new position. Could you tell us a bit about your well, I guess your previous position, your new position, and what you actually do on a day-to-day basis?
Yeah, so my previous role was as digital transformation lead for the National Care Forum. So the National Care Forum are the membership body for not-for-profit adult social care providers. So that's been very much around supporting individual adult social care providers to be able to make that digital journey. And informatics is really key to that. But the difficulty is that actually within social care organisations, you don't necessarily have somebody that's doing that designated informatics role. So it's about how you can kind of support the workforce to understand that what they're doing might have a statutory job title within the NHS, but not necessarily within social care. And my new role I start on Monday is transformational lead for the independent health and social care sector at the Royal College of Nursing. So it's much more wider than just digital aspects, and much more wider than just adult social care and not-for-profit adult social care at that. So it's really kind of, yeah, it's a very exciting step. But yeah, it's a funny thing to be coming and doing a webinar when you're sort of kind of between roles, isn't it? And the other role that I do have is, as you mentioned, with the PRSB, I'm actually a non-exec director at the PRSB. So I support them to try and do better things specifically with social care as well. That's me.
What do you think your top priorities will be in role? What do you think you'll focus on? Obviously, there's a huge remit within your new role. So what do you
well,
I'm sure yet.
I don't want to say I've opened my laptop and looked at some of the meetings I've got in there, but I think there's going to be an awful lot. I think that there's some major challenges for the independent health and social care sector, not least of all that actually, the Royal College of Nursing is currently balloting its NHS members for potential strike action. So it'll be very interesting to see what happens outside of the NHS membership as well.
Very interesting, very interesting. And no doubt you'll be lobbying for CNIOs within social care.
100%, and just better use of informatics and better understanding of informatics and better kind of acknowledgement that within the social care sector in particular, it's not necessarily going to be a nurse, because there's so many organisations within social care where you've got registered managers, you've got senior care assistants that are doing these roles, but it's just not recognised because they see the roles of people like Simon and Sam, and they think, oh, that's not me. But actually it is you. You're just doing it in a very, very different setting, and it's very hard to kind of recognise that what you're doing is so important when you kind of can't see that career progression, or you can't see where you sit within this whole. So yeah, I really want to encourage kind of better recognition of informatics across health and social care.
That actually does fit in with our CNO's plan, wasn't it? What good looks like, that we should have that across, well, certainly across the NHS and beyond. So Claire, good point there. So next, Simon, I might come to you next. Is what do you think the 3 key skills that are most important in your role? And could you tell us a bit more about your role as well for those who may not be familiar?
So I came into this post in 2017. It was part of the WACTA review Global Digital Exam Program when this role was created. And what I've done in that time is created a small team of informatics nurses. So I have 2 seniors and some juniors, although they're not particularly junior, and I'll come on to that in a minute. What we do is we provide the bridge between operational, technical and clinical. So interpreting both ways, we look at clinical workflows, we support users and training, where we look at different aspects of clinical documentation and looking at the documentation standards, but most importantly probably is the build, looking at the way we use our electronic record and the way that is being monopolized and utilized effectively across our organization. So that's sort of where I am, and I lead that. I work alongside our CCIO, and we work together collaboratively to help lead the clinical part of the EPR rollout, so that we clinically led and technically supported. And I work very closely with our chief nurse to help keep the standards appropriate with the organizational corporate direction. Qualities, 3 main skills important to your job. You definitely got to be a people person. You've got to understand the healthcare organization you're working in, wherever that may be, and you need to be able to understand and deal with people on a personable and level playing field. You need to know how to speak to clinicians, and you need to understand them and the way that they want to use their clinical workflows to make sure that the informatics solutions we're putting in place are appropriate to their needs. And that dialogue and that understanding is probably the biggest part of it. What I say to people wanting to come into the career quite often is that you need to be clinically credible. So having a robust clinical background and being able to demonstrate that you have walked the walk before you start talking the talk, for want of a better phrase, is a good place to be, because then people see you as a peer. They see you on a level playing field. They don't see you coming in trying to do something that you don't understand. And also having a good scope of clinical experience means that if you're trying to interpret or implement a new clinical workflow in association with a clinical team, you can more readily understand what their needs are, and then look at your systems and offer the most appropriate solution that gives them the best outcome. And those are the sort of thing. The third thing is, I think, having a good project management understanding, because there's a lot of project management work in digital. There's a lot of scoping, understanding, implementation, and although you may not be doing that yourself, you'll be working with teams who are doing it with you or for you. So understanding how the project management process works, understanding how that affects the rollout and the implementation of a particular solution or a workflow or a task is really very important, because that will allow you to manage and firefight in an effective way as projects ebb and flow. And there will be challenges along the way. There always will be. Nothing ever goes completely smoothly, and it's understanding how you manage that and work with it to best enable both the technical people around you and the clinical people around you. So I think, yeah, so being a people person, being clinically credible, and understanding the projects and project processes within your organization, I think they're probably the things I would pick up the top of my head, although during the course of this conversation, I'm sure a multitude of other things will come out.
Thank you, Simon. I think agility is one of those, isn't it? That ability to think.
Yeah, it's been able to apply yourself at short notice, being able to understand and respond at short notice, and respond effectively. And I think a combination of all those things will allow you to do that. And it's enabling you as a clinician and as a clinical informatician to be able to support services appropriately and quickly and meaningfully. So yeah, that's the way I would look around it.
Thank you, Sam. What a wonderful overview. And Sam, I'm going to come to you for the same question actually, but Sam, it would be great to hear a bit about your role. I know you work within the acute side. So how does your, I know you've got a similar role to Simon, but could you tell us a bit more about your role, your day-to-day role, and also what you think the 3 key skills, which may well be the same as Simon, you might have a slight variance on that as well.
I was going to say Simon's just said everything I was going to say, I think. Yeah, I started in this role back in 2017 as well. That was part of rolling out of an EOBS project within the organisation, and sort of fell into the CNIO role, like I think a vast majority have. It became formal probably 2019, and I've been here since. So on a day-to-day basis, I concentrate a lot on the clinical safety side. So I'm also the clinical safety officer for the organisation. So we look at the systems and the processes and make sure they are safe for patients and staff to implement. It's quite a new process to the organisation, so it's been evolving over the last couple of years, and it's been quite a challenge getting people engaged with it, to be honest. But it's now showing it's working, which is really good. So I've set up a multidisciplinary team group that signs off the clinical safety cases. I've managed to train all my staff. So I've got a small team, a bit like Simon, of nurses that work with me. And they're all trained in clinical safety as well. So we're trying to embed it across the organisation now. On top of that, we're also doing project work. So we link up with the project teams within digital and also the QI teams. So quality improvement teams are growing and growing, I think, across the organisations, and a lot of the solutions are becoming digital. And we're trying to get in with them right at the beginning, because sometimes we've already got a solution and we just need to use it in a slightly different way, but still a safe way. Using the data, I think, is more part of our role as well, and that's something we're trying to push for at the moment. So all my team at the moment are doing a QI project, so we can look at the data, and I'm trying to encourage them to start looking at that so we can share it with ward staff as well. And I'm looking at data across the organisation in trying to prepare for our EPR journey, which I know some of you have already done and on. We're right at the beginning of that, so that's my remit at the moment, is to look at that EPR journey and make sure nursing documentation and processes are embedded into that properly, rather doing it with rather than to, which I know we're quite fearful for. I think the 3 skills, I had it in 3 words actually. You need a lot of patience, working with everybody. You need to be able to negotiate with both sides, because you are that liaison link, and you need really good listening skills. And I would add to that and say interpreting skills as well, because you need to interpret what people are saying to you to be able to give it back to somebody else. Because you are that translator. I use that word usually. We translate from clinical and operational to digital and vice versa. I still say I'm not a technical person. So the technical guys do have a little bit of a leniency with me sometimes, because I can't put it into the right language for them. But they're starting to understand what I mean now. So we've got a common aim, I think, there.
Brilliant. Thanks, Sam. And it's true, you're a translator or a conduit, aren't you, for that information? Just on that thing, what have you seen? Because obviously you've been enrolled, one of the first kind of CNIOs in the country. What's been your biggest challenges since you've been enrolled since 2017?
I think the biggest challenge is actually getting the role recognised and understood within organisations. It's understood and recognised in America because they're quite a way ahead of us. So a lot of my research around the role came from America, because I ended up writing my own job description. I know the faculty now, we're starting to develop things, and I sit on NAMPIG as well, along with some of the others and some of the working groups. And yes, I hate the title NAMPIG. But it's getting yourself involved with the networks and understanding who else is out there, because it's very lonely. When you first start, you're a one-man band usually. I was quite lucky and managed to get some small team on site, and it's not as lonely now. And developing these networks, doing things like this webinar, joining the RCNE Health Forum, FCI, things like that. You've got somebody that you can call on. There's a few faces on the webinar that I know that I've called on previously for advice. And I think it's being not afraid of asking for that advice as well. Knowing your limits. There's somebody out there that's done it already somewhere. Don't make work for yourself.
No, I'd actually totally agree with that, actually, because I remember when I first came into post, and you're quite right, Lucy, there were very few of us. Well, there were a few of us around at the time, but we were very disjointed, and there wasn't really good framework as there is now. And I think that one of the things I felt very early on was you sort of floundered a bit. You didn't know where you were going or what you were doing and trying your best. And I think I was really, really lucky, actually. I've got some fantastic seniors working with me, and I was made to build a fantastic team to help support. And I think that and the acceptance from our technical teams of who I was and what I could bring was really, really important. And alongside that, I was really lucky to develop a really good relationship with our chief nurse as well. So not only did I was really lucky, because I don't know about your experience, but there are some organizations across the country who don't have that relationship between chief nurse and CNIO or CNIO equivalent. And what that means is you tend to get left out on a limb. And I think it's important, if the organization has a professional strategy to interpret professional nursing practice and put it into the patient domain, then they need to have that relationship in order to facilitate that and make it work. And that's exactly what we're doing at the moment.
Wise words there, Simon. And Sam, I know that obviously it's got to come a long way. Both of you said it's come a long way over the last 5 years, and great that we're getting that recognition. So Sam, I understand you've been part of the Philip Ives inquiry, so it'd be great to hear a bit more about the work on that. And I did notice Helen Ballston just has come onto my screen, so I might be a bit impromptu and ask for Helen's involvement as well. But Sam, I know you've been involved, and it'd be great if you could share with the group kind of what it is and what the inquiry is covering, essentially.
Yeah, so it's a review set up by Natasha Phillips, who's the National CNIO, and Jeanette Ives from America, I have to get it right, who's the equivalent. Thank you, Helen, nodding. They've set up this review based on TOPL, so it's an extension of that, but it's looking at the nursing workforce around the use of digital. And it's how the nursing workforce is going to change in the future using digital, and patient care may change in the future. So we've got 3 panels set up. One is AI research and data science. For my sins, that's the one I sit on. It's a real big learning curve, but it's really interesting. There's a person-based care, which is around wearables and where people are actually looked after and how that may change. And there's also the digital workforce. So it's the likes of everybody on this webinar. How's it going to affect all the nursing staff and AHP staff and community staff, Claire, that are going to be working within digital? So there's a website out at the moment, a platform. I will send it round with the slides. I'm sure we can send that link round. If not, Helen can put it in the chat because I haven't got access to it right now. Thank you. So anybody can access that, and you can put on their case studies, you can ask questions, you can give us ideas. We're in the process of literature review at the moment, all the academic research, but we've also run a few round tables already, and there's 3 more coming up. So each panel's got 2 round tables, which is, I was putting a call out for anybody that wants to come and have a chat with us and tell us their experiences, and that will go into the evidence as well. As part of panel 1, we're also setting up, this is my little personal call, we're setting up 2 specialist interest groups, one for AI and one for genomics, just so we can do a brief round table on each, because we found there's not a lot of nurses that think they're doing AI. I say that because I didn't think I was doing AI, but when I started talking to people, we do use AI, using news scores, using Waterloo scores if they're electronic, anything like that that's nursing based. So we want more people that are on the shop floor, anybody that uses it in day-to-day life. We've got a load of academics and we've got a load of researchers. We need the people using it. So if anybody's interested, contact details will be coming out. Thank you very much. But it's really interesting work, and hopefully it'll come out with some recommendations later in the year. And Helen has put the link on there. Thank you.
Thanks, Sam. Thank you so much. And I'll come to Helen in a moment, but just for those who have got, please do get involved. As Sam says, it's such an important inquiry to get users on the ground from all experiences and all backgrounds would be absolutely wonderful. And we'll share the link in the follow-up email shortly once we finish today. Thanks, Sam. Thanks so much. Helen, we're quite privileged to have Helen join us this afternoon. Helen, I hope you don't mind me putting on the spot. Are you happy to quickly introduce yourself for those of you who might not know you on the call, and maybe just give a bit of further insights into the Philip Ives inquiry, if that's okay?
Thank you. I think Sam's covered it absolutely beautiful, so I'm not sure I can add any more. For those that don't know me, I'm Helen Balston. I'm currently head of digital nursing at NHS England and one of Natasha Phillips' deputies. So this is clearly quite a massive piece of work for us in really trying to work out where we are and where we go. We know Topol was a great piece of work, but really didn't look at what that would mean for nurses. But nurses didn't get that much of a mention in there, but we know that we are one of the biggest workforces, and we know that we've got significant challenges coming. We're in the middle of some of them, but we've got even more to come if we don't change the way in which we work, and if we don't really harness technology to make sure that we can be the best we can be, as well as we can be harnessing some of that. So this review is really looking to that, 5-year, 10-year plan. What will it look like? What will that do for nursing? So hopefully come up with a lot of questions and answers that over the next few years we can start really going, and actually what are we going to do with this information to change the way in which we practice and put all the things in terms of the recommendations, what gets put into place.
Brilliant. Thank you, Helen. I'm sorry, so sorry for putting you on the spot there, but your face popped up and I couldn't help it. So thank you so much. Great, thank you. Well, Helen, that's a nice segue, even though you don't know. But Claire, my next question was going to come to you. Actually, how do you see, so obviously we've got the inquiry underway, but how do you see clinical informatics kind of evolving over the next 5 years?
Well, I mean, I think for nurses that are working in social care in particular, I think that we're going to get ourselves to a place where actually we have Simons and we have Sams within social care organisations. And I think that the formation of the ICSs will be quite fundamental to that, because the integrated health and social care system, hopefully, if it all works very well and we do have that true integration, will mean that social care organisations are having to adopt technology much more rapidly, and we'll start to use the data that they're producing. So there's big targets out there about getting 80% of care homes to be using a digital social care record from the assured supply list that can feed into a local shared care record by 2024, and 60% by 2023. And that's big numbers. It's a huge ambition. And actually what's quite crucial to that is people understanding the data that they've suddenly got at their fingertips. And if we don't look at the informatics side of things, then it's useless data. It's just going to be data that's just sat on a server instead of sat in a folder. And ultimately, it's going to be data that's going to be more valuable to other people than the people that are actually creating it. And I think that's where having things like the Philip Ives review is so important, because it's showing us that actually as a whole, as a profession, we're all in a position to be able to feed into this common shared goal. And when Helen mentioned then about things like, when Sam mentioned about the using AI, you're all using AI. If we're inputting information into a digital care record, regardless of whether it's in a hospital or community or social care setting, if you type in some numbers and it comes up with a red, amber, green score, that's AI, because it's using that. You are not using your individual nursing skills to make that decision. A computer algorithm is making that decision for you. So you might not think that you're using things like predictive analytics and AI and stuff like that, but actually you are. Because when you're feeding that information in and it's firing out an answer to you and it's saying, well, hang on a minute, this person's MUST score, we can see that they've lost weight over the past however many months, flag it up, do something. There's an algorithm behind that that's done that. And I think that the kind of the next 5 years, certainly from my perspective for social care, is that we're hopefully going to get that parity of confidence and competence from within nurses and our wider profession within social care settings, for them to believe that what they're doing is clinical informatics. And I think at the moment, There's lots of people that are doing it, but they don't know they're doing it. And if you try and tell them they're doing it, they go, oh, no, I'm not. No, I'm not. But actually, you really are. And you're doing so much better than you realize you are. And that's where I think having things like the faculty is so important, because it's that recognition of feeling that you're not alone and you're not the only person doing this. And actually, you are part of a thing. You're part of a system. And I think that, you know, we can all support each other. I know Simon and Sam have both spoken about feeling very alone. I know that feeling well. It's really hard. And having these networks of other people that are in a similar situation is so important to helping drive that kind of next 5 years. So I think it's a really exciting time, for sure.
Thank you. And it's so true, the power of a network. I think of being part of the Florence Nightingale Foundation, it's amazing how you can share expertise and experience. So actually, and we're all digital healthcare professionals, aren't we? Digital nurses and midwives. We just don't recognise it. So important points there, Claire. Let's start a digital revolution amongst us nurses and midwives. Let's do it. This is the start, one of many interventions to try and bring us all along together. So Simon, I might come back to you again, if that's okay, and just see if anything you wanted to add, obviously from an NHS perspective, Claire's obviously from the social care side. From how do you see clinical informatics kind of impacting over the next 5 years, being that you've been in post for 5 years now, actually?
Yeah, I mean, it's the way things have moved on, particularly over the last 2 years, it's been quite breathtaking. And you know, obviously we would have all done without the pandemic, but what the pandemic did is it forced change, it forced adoption, it made us think more creatively about how we could care for our patients and how we could manage and care for each other without most effectively, but also without putting each other at risk, and you know, and how we could work more dynamically. And I think that's had a real phenomenal impact. And from a personal perspective, I mean, my dialogue with other informaticians across the country has grown exponentially over the last year, and it's very, very clear that the level of adoption, the level of new installations, the level of integration, and the way that the environment in England in particular is changing from just being a hospital or a local system-based thing to the ICS process. So the integrated care board, integrated care system process, where we will need to start talking to each other. We will need to start sharing data and information about the patients in our care, so that we can augment and facilitate patient flow through our organizations, but also out into the community, to make sure that there aren't any walls to care. And things like virtual wards, for example, has been one of those things which has really taken off, and there's still a lot of work to do there, but it shows the opportunity that can be had by caring for people, but not necessarily bring them into hospital, which is the last place they want to be. So there's a lot. It will start to grow or start to expand, but also the challenges will start to grow and expand. So there's going to be workforce challenges, finance challenges. There's going to be conflicts of priorities when we go forward. So it's understanding how we can show digital as being a facilitator for better care and also better sharing of data. I mean, as Sam quite rightly pointed out, data is the big thing. And I think that if we can encourage new starters, if the faculty can help to encourage better education, better training, better understanding, then we're looking at what good looks like success factors. We've got smart foundations where we're enabling our workforce, we're using our data effectively. So all those things come into play. And just on a side thing, Helen and I have known each other for many years, and Helen was one of the people who came to my aid when I first came into post, providing me with guidance, direction, and support. And one of the things, we've ended up on the digital health CNI advisory panel together, and as a result of that, I've got a much more expanded group of people who in my digital arena who I can call on for help. So that's a sort of it's not just the technology is expanding and the way we use it, but it's also the people and the environment that's expanding, and it will become more and more supportive and more comprehensive in the future. And I'm talking far too much, sorry.
No, not at all. It's all really relevant, all very, very interesting. So thank you, Simon. The chat's getting very lively, but I'm aware that I need to focus on you as well. Thank you. And lots of really good nuggets of advice there. I guess we're going to come to the group in a moment for questions, but I've just got one last question really for all of you to answer, one for you, Jan, as well, if that's okay at the moment. But how can we get more nurses and midwives involved in the clinical informatics arena? What would your kind of, I'll come to all three of you actually for your response. So how can everyone get more involved in this agenda? So I might come to you first, Sam, if that's okay.
Yeah, I think it's raising profiles, so doing things like the webinar, getting out there on the shop floor. One of my team went out yesterday and we found a second-year student nurse that's really interested. So arms have gone around her and we're trying to help her go along the career path. It's talking to people is the main thing, joining all the networks. There's Shuri, there's Florence Nightingale, there's FCI, BCS, there's hundreds of them out there that you can join, and we all get together at some point along the road, and you find most of us belong to more than one, because that's quite normal, I think. And there's also eHealth Forum. There's, join a network. There's Digital Health Discourse, which is really good. Future's website is really good. There's a lot of lively discussion going on there, and I think that's the best way, is to get in on those discussions. And it doesn't matter if you think it's a silly question, it's not. Somebody will be thinking about it. So ask the question and use the support that's out there.
Brilliant advice, brilliant. So, and we'll share a list of those networks with you in the follow-up email. So thank you so much, Sam, really helpful. To Claire next, kind of what's your encouragement for people to join the agenda?
So way back when I went back to uni to do my nursing, so I was 25, I was a little bit older. That first day of nursing school, they handed a microphone around 245 of us in this lecture hall and asked everybody what kind of nurse you wanted to be, what realm of nursing did you want to go into? And of course everyone's like, I want to work in paediatric ITU, or I want to go and work in a hospice. And I said, oh, I want to change the world. And everybody laughed at me. And I said, no, I want to be in a position to be able to support all of my nursing colleagues to have the best tools and the best skills to be able to do their job to the best of their ability, because that will change the world. And that's exactly what nursing informatics does. It enables every clinician, every person that is supporting other people to be able to care for their patients, their people, their residents, whoever they're looking after. And I think we need to get that message out there. And what I would really strongly advocate for is that we need to have this kind of solid voice that actually between us, all of these different networks are brilliant, but actually it's quite disparate. So we need to kind of bring that together and have this unified single voice of what nursing informatics is and what clinical informatics is, because it's not necessarily just going to be nurses, it's going to be lots of different professions. And I think we need to publicize what it is, because like I knew I wanted to be a nerdy nurse, I knew that from the off, but actually how many nurses are going through university and don't even know that this is an option for them? They don't even know that this is a whole career out there, and that, you know, it's a growing career. This, you know, it wasn't that long ago that I was in uni and asked that question, but at the time it wasn't something people necessarily thought of as being an option for them. So we need to get that message out there, I think.
Definitely, absolutely. A world of opportunity, and I love that, Claire. You want to change the world, and you certainly are contributing to that, that's for sure. Thanks, Claire, that made me smile. And Simon, any last kind of takeaways from you, how people can get involved, and any
well, firstly, as far as Claire's last comments were concerned,
yeah,
with you all the way.
absolutely.
I think that one of the things which is essential is that we talk. I mean, as Sam quite says, we talk, engage. We find that the interested parties and the people who are willing to get involved and dip their toes in the water, but we need to do that earlier We need to do that right at their nurse training. We need to get into the training institutions, and we need to get it onto their modules, and we need to get it into their curriculums, so that we can make them understand. Because as Sam alluded to earlier with data, they don't understand how data works. They don't understand what they're doing on a day-to-day basis. So if they're using digital to create a record, they are creating data. So how do you use that data to make care better? And that's the sort of cycle we need to get in. But understanding your environment, understanding your workforce, engaging with people, and reaching out to different parties beyond your organisation is really important. I know I've started working recently with our local ICS, and looking at the local midwife network as well, and that's really useful, because it gives me a broader view of what's going on outside of our organisation, so that I can understand what institution like where Claire works, for example, the challenges they have and what we can do to help support them. So talk. Nurses are good at that. Let's just get on with it.
Connect, have a great network.
Yeah.
Is a big takeaway. So I'm just going to come to Jan, and then we'll open it up to the floor for questions. But I have noted that Fran Beadle's with us as well. So we've got another giant in the informatics world. I'll come to you in a minute, Fran, if that's okay. Thanks for joining us. But Jan, really, we've been talking about education and training. How can people upskill themselves even more in clinical informatics, and what can the faculty provide for all of us who want to learn more?
We provide all sorts of different ways, because people have got different needs in terms of support and learning. Perhaps a good place to start is the website has videos from people who are at different stages of their career, talking about how they got into informatics, how they developed their skills and so on. That's on our careers and development opportunities page, and there are some signposting to different courses and development opportunities there. We do webinars sort of fortnightly on different sort of topics, again, sort of skill people up. There are lots of different networks and special interest and professional interest groups, as Simon mentioned earlier, things like if you want to find out about clinical safety, artificial intelligence and so on, you can sort of you can join groups, and then there are some people who are experts in the field, for other people who are just starting out, so it provides an opportunity for support. And we also have a sort of quite an informal mentoring program, matching people up with mentees and mentors, to take forward sort of discussions and get support around getting into or developing careers. So those were some of the sorts of things that could be helpful.
Thank you so much, and we'll share the links in our follow-up email as well, so you can get involved in a wealth of knowledge sharing there in educational tools. So please do get involved. So thank you all, panel. You can relax a little bit. I'm not going to grill you anymore, but we're going to go out to the wider audience for some questions. But we've got a few experts in the room, virtual room as well, we might go to. So Helen, sorry to put you on the spot just now. I might come back to you. And we've got Fran with us as well. But Fran, I noticed you popped a comment in the chat. I didn't know if you wanted to kick us off with questions from the group and share your insights into, I think you said something about a student placement within Wales, which would be really great to hear a bit more about, and perhaps get some comments from our panel.
Yeah, I mean, we're quite lucky in Wales. We're quite a small nation, which has allowed us to really grow our nursing informatics teams from, it all started obviously from the inception of the Welsh Nursing Care Record. But now across Wales, we have a network of CNIOs, we've got clinical nurse specialists. Because we link very closely with our academia, we've got, the nurse placement, but we also have our Florence Nightingale scholars as well. And in fact, 2 of our Florence Nightingale scholars have now got partly digital roles. So, it's about, we've been able to grow our own, but having the educational support around it as well. We provide a complete program for our scholars, but actually we want to make sure that, we're nurturing them on their journey. There's some that never thought that they were digital scholars that are on the call as well. And, that turns out they are. So for me, it's about, nurturing what we've got, but actually starting from the very beginning and embedding digital thread throughout everything. We have a career pathway that we have from from the scholars, but also a master's program was developed off the back of it as well. So for me, I'm very lucky. I've got a fantastic team around me, but it's growing them and supporting them in their roles, and you know, going out there, like Sam has said, you know, you find people on the wards that are out there, and the introduction of technology and COVID has really been an enabler of this. If there's one good thing that has come out of COVID, is that people aren't scared of change anymore. You know, that word digital puts the fear of God into everybody. That's not the case anymore. Now they've got it, they want more of it, and it's about how we're going to manage that to ensure that it's safe and user friendly. So that's just would be my key message.
Thanks, Fran. Wow, lots of gold nuggets there as well. And absolutely, isn't it? I think the integration of the integrated care boards, when they come up and running, we're really working across systems, is really going to capitalise on that as well. So it's interesting, really. And Fran, thank you so much for joining us. What a pleasure. And a good plug for the scholarships as well, which are open soon. We'll share a link. So they're open on 10 days time, countdown. Applications open from the 15th of August. You've got 2 months to apply, don't worry, we're not too mean, so the end of October. But the scholarships are transformational, so don't just take my word for it. With lots of testimonials, and I think Fran's been a previous scholar. Helen, lots of nods around, and there's a few scholars on here as well, I can see. So anyway, I'm going to go across to any questions from the group now. So is anyone feeling brave to ask in person, or I can go into the chat box and ask questions on your behalf? Please do raise your virtual hand, because I can't see you all. And if you feel happy to put cameras on, it'd be lovely to see your faces as well, if you're able to. So who would like to ask any of the panel or any of the other attendees today a question about the clinical informatics agenda? I've seen Helen, you've just popped your camera. Is that because you wanted to ask Helen Williams? Did you want to ask a question? No, not yet. No. Springing onto you there. I think Jan's actually popped a link in the question around the diaspora groups. Jan, are you happy to ask a question to the group, or to any of us?
Yes, hi, I'm Jan Ariola. I used to be a Florence Nightingale Scholar back in 2019. And yes, I'm also part of the International Nursing Diaspora Project Expert Working Group with Florence Nightingale. Really good. So I think it's best, I'm not sure if clinical informatics is open to collaborate with this type of groups, in terms of, because we do offer webinars, we offer this type of programs as well, just to reach out to our international nursing communities. Because what we have seen from the themes, most of them mainly are bedside nurses, and some of them do wanted to specialize in terms of advanced practice, but I know for sure that some also wants to specialize in this field. And looking at statistics, we cannot really see some of these international nurses in this kind of roles in nursing. So, I mean, it will be really helpful if we can also collaborate. I mean, I'm part of the Philippine Nurses Association, and I think it's best if we can have this as part of our future topics in our delivery.
Right, I'm going to go to Jan with that one. So Jan, are you happy to answer, and perhaps could you connect with the INMA, the International Nursing Group and Diaspora groups?
That would be great. Yes, absolutely, would support that. I mean, we've got links with European and Australian groups, but not with the international groups. So that sounds absolutely brilliant. Yeah.
Wonderful. Jan, we can connect
afterwards.
you.
Thank you so much. We'll get in touch. Thank you.
We'll connect you. We'll connect you through the foundation. So wonderful. The power of the network. Back to that point, isn't it? Key point. Sam's going to ask a question over to you, Sam.
Yes, sorry, I was just going to say, Jan, it would be great to catch up with you from the CRCN point of view as well, especially with Claire as well, looking at all regions. So it's not just NHS care. I think the eHealth forum that works within the RCN and Claire's group with community, I think it'd be great to catch up with you and involve you more.
Brilliant, great. Well, there you go, Jan. You've got a power of the network. You've got connections with Sam, Claire and Jan from today, so please do utilise that. It'd be great to hear how you get on, actually, how things progress. Anyone else like to ask a question, or should I go to the chat box here? Just quickly. Vanda, you had a couple of comments in the box. Vanda, are you happy to share your thoughts and comments or any questions you may have?
Yeah, certainly. Good afternoon, everybody. My name is Vanda Carter, and I work at Wolverhampton. Would you say, I'm addressing all the panel members, that you have a natural interest in IT and all things informatics before you took on your digital and informatics roles, and do you have a natural flair for it?
Sam first. I think she's making the most. I'll go to Sam first, if that's okay.
I'm going to confess, no, I didn't. I am not what you call a techie or a geek, or okay, I've got the latest iPhone and iPad, but that's about it. But that's for games and reading. So no, not until I did the project right at the beginning of it. I'm surgical by background, so I suppose surgical, there's a bit more data and things with surgical site infections that we were looking at. But not until I did that project, then I suddenly realised how it can change the workforce and how we can change the lives of people. And that's what ignited my passion. And now it's just, I need to keep going.
Brilliant. Thanks, Sam. Claire, over to you. Claire.
Yeah, I did, definitely. But I don't think you need that. I really don't think you need that. I think, you know, when we spoke earlier on about kind of what 3 skills do you think that people need to have to go and be a nursing informatics professional? That's a really hard question. I know the one skill you don't need to be technical. You absolutely do not need to be techie at all in order to be able to do this. So I did, but that's just because I am a nerd. I don't think you need that at all. I think it's having a passion for how you can really, really improve nursing care. That's what matters. Because actually all this is, all the data and all the tech is the tools to be able to do that. It's in exactly the same way of everything else that we do in nursing. You use the best dressing for a wound because it's evidence-based. You use the best, I don't know, the newest Venflons because it's evidence-based and it reduces sharp needle stick injuries. Technology is just the latest evidence-based bit of information that we need to be able to provide really, really brilliant nursing care. You don't need to be a nerd. You don't need to be techie. You just need to be really passionate about how you're going to support the people that you support.
Great advice, Claire. Great advice. Passion, isn't it? Absolutely. I can feel it from you as well. It oozes. Thank you. And just finally, just to Simon, actually, to Vanda's question, that's our final question, I'm afraid. We're running out of time. So over to you, Simon, for your...
What they said, basically.
What they said.
I think that's absolutely right. I mean, I was a bit of a geek beforehand. You know, I used to fiddle with computers and that sort of stuff. And because I did that, I naturally fell into an informatics role in critical care, supporting a local critical care system, which is how I got into it. But I think if you're passionate about nursing, if you're passionate about quality, if you're passionate about people, if you are a good communicator, if you're brave to take a plunge into and talk to people you wouldn't usually talk to, and if you're analytical about what you do with your care, your data, and the way you implement it, those are the things which will get you very far. You don't need to know how to code, although some people will tell you do. You categorically don't. But what you do need to do is be able to understand the concept and understand the implications. And those are the important things, because then you can translate stuff and you can look at the clinical workflow and show the clinicians how digital will work for them, and you can talk to the digital people and say, well, this is the implications what you're doing has on clinical workflows, and that's where you need to be. And I think we've all said the same thing in slightly different ways, but that's the way I would put it across.
Thank you so much. And sadly, we've only got a minute left, so we're going to have to wrap up for today. But what an amazing hour. Thank you so much to our panelists, Sam, Claire and Simon. Thank you for sharing your wealth of expertise and knowledge and encouraging us all to get involved in the digital and clinical informatics agenda. Please do sign up to the Philip Ives Inquiry. We'll share the link with you in our chat. Look out for our scholarship applications. We have dedicated digital scholarships. So Fran, thank you for the plug there. And many of the wonderful nurses and midwives on this webinar this afternoon have been through that process. It's incredible transformation, so please do look into it. And also linking with Jan at the Faculty of Clinical Informatics to look at the educational programs you can access. Share it far and wide, share it with your teams, your colleagues. We filmed today, as we said, so that will be on our YouTube channel shortly once we've edited it. Please do share this far and wide so we can really start making an impact on this agenda even more. Thank you all so much for joining us. It's been an absolute privilege. Have a great weekend and enjoy the sunshine wherever you are in the world. And thanks for joining us. Take care all.